All right, I've got 9 a.m. in Washington State, and wherever you are, good morning or good afternoon. Thank you so much for being with us. You'll notice a prompt on your screen. We are recording this, and this will be sent out on your recap in a few days, as well as any resources that are shared this morning. So please accept that prompt. Next slide. This morning, our Innovation in OUD Care series is talking about treating OUD in correctional facilities. We have the wonderful Marjorie Drieu with us, Lieutenant Jeff Gepner, and myself. My name's Maria Clemestrud. I'm a Senior Improvement Advisor with Comagine Health. We'll talk a little bit more about our panelists in a moment. Next slide. This is our fourth of 6 sessions, and just giving you a preview of what's coming up January and February. Session 5, we are very fortunate to have Bicycle Health with us to talk about their recovery peers and their programs to integrate care. And then in February, we will have a discussion about pharmacy integration and OUD care. So we hope you will join us for both of those. Next slide. All right, this is where we have a little bit of fun. We'd love to have you put your name, your organization, and your role in chat. And also, if you click at the top of your screen on View Options, you can choose Annotate and then choose a stamp and put yourself on the map. We want to see where everyone is located. Be great to welcome all of you. All right. Nebraska is in the house. Idaho, fantastic. Nevada, Mississippi. I think that's my friend Farai. Wonderful. Oh, no, I'm sorry. Farai, you're in Tennessee. Welcome, Mississippi. From Idaho. Great to have you. Please put your name in chat. Let us know who you are, where you're located, and your role. And then choose an annotation on the map. All right, Harbor Crest is in the house. Pennsylvania, welcome. Great, give you one more minute as folks join. Let us know who you are, where you're located, and your role. And then populate yourself on the map. Great representation today. All right, next slide. I see some familiar names from our last session. Comagine Health is a CMS quality innovation network located in 6 states. And we're fortunate to have others join from other states this morning. Our mission is, together with our partners, we work to improve health and create a better healthcare system so that people and communities will flourish. Our opioid work is so important right now, addressing the opioid epidemic, and it's why we started this series, to try to get innovation out there so that we can be fully transparent and share best practices among peers and have peer learning, and to hear from all of you about what is working where you live. So as we proceed today, if you want to share resources or contacts or links, or if you want to connect back to our panelists, go ahead and put that in chat and we'll make sure that that happens. And then we do send out a recap with any resources that you've shared this morning, this afternoon, that we can share out near the end of the week. So thank you so much for being with us. We purposefully want you to, we didn't close the view in Zoom. We purposefully left it open so that you can put in chat, you can raise your hand, you can ask questions, and as we have time from our panelists who are very happy to field your questions, we'll do that throughout the hour. If we don't get to your question, we will circle back and connect with you when we are finished. Next slide. Our learning objectives today are to really just listen and apply principles to look at expanding knowledge about OUD care because the field is changing so quickly, to learn from persons with lived experience, to follow behind those persons with lived experience who are the real subject matter experts on this topic, and then to constantly evaluate the impact of stigma, implicit bias that we have, and learn new ways to open the door wider to reduce stigma for families, communities, and institutions. Next slide. So this morning, as I mentioned, we are going to hear from our panelists. We're going to hear a recovery journey story, as well as hear about therapeutic courts and peer services from Marjorie. And then Jeff Gepner is a lieutenant at South Correctional Entity, and they're doing a lot of progressive things, and they have been for some time. Marjorie and Jeff happen to work together, and they'll be sharing about that program. And then we'll let you know about what's coming up in January. Next slide. As I said this morning, we have Marjorie and Drieu. Marjorie and Lieutenant Jeff Gepner. Marjorie Drieu is a program manager and person with lived experience at Pure Kent. Lieutenant Jeff Gepner is at South Correctional Entity. Thank you both for giving us your time this morning. All right, I am going to hand it over to Marjorie. And as I said, if you have questions for her, please put them in chat and we will field those as we can. And take it away, Marjorie.
Thank you, Maria. Good morning or afternoon, everybody, depending on where you are. My name is Marjorie Drieu. I use she, her pronouns. And on May 6th of 2019, I got arrested on 2 felony warrants. I was taken to King County Jail in Seattle, where I told the nurse that I would be heavily detoxing and withdrawing as I was a daily opiate and meth user. The nurse went and drug tested me to verify and came back and told me that I was pregnant. This was my 17th arrest. The 16 previous times were very different. Right away, the 17th time, I got put on methadone to protect my baby, which was the first time that I had been put on medicated assisted treatment while in custody in jail. So the 16 other times that I'd been arrested, most of those actually happened at Score Jail, where Lieutenant Gepner works. And I very vividly remember that every time I would go to jail, it was a cycle, right? And in that cycle, I would be in the car, in the police car on the way to jail, and just waiting and waiting and knowing what was coming. Things that I remember are getting ready to not have a pillow, right? Getting ready to, I see Gepner laughing, getting ready to not have a pillow, getting ready to sometimes not have socks, and preparing for the mental and physical toll that my body was about to go through as I was detoxing from opiates, from heroin. I was never able to sleep for about 3 to 5 days. When I would get arrested, I couldn't sleep. And I remember trying to close my eyes when I would get in my cell and just images popping up through my head of everything that was happening on the outside of jail. And that paired with the restless legs and my body going into withdrawal. And I remember not being able to close my eyes for more than 30 seconds, if that. Not sleeping in jail when you are locked in a cell for 22, 23 hours a day with 4 to 5 other people in the cell at the time, and it's a small cell, it does something to you, right? And that was the one thing that I looked forward to the least, was the ability to not sleep, or the inability to sleep. When I would sleep, I would have dreams, and after the initial detox was over, I would have dreams of constantly just using, and I would wake up and be surrounded by white walls. And I was like, damn it, I'm here again, right? Because it was a cycle that I put myself through, yes, but it was a cycle, and it was one that took an absolute mental and emotional toll on me. There wasn't, when I was getting arrested, I started getting arrested in 2012. When that happened, there wasn't medications in treatment or in jails and correctional settings, not for withdrawing at least. And so that 17th time, right, in May of 2019, when they put me on methadone, it was a bearable detox, completely different than any other time that I had experienced it. I was able to sleep, and this was monumental. Because it allowed me it gave me the opportunity to put some time together, right? To put some time without withdrawing and without exhausting my body. And so it made a difference. It made a big difference in the sense that I was in jail for a month. And when I got out, I was stable enough to be able to make a decision to recover and to give the drug court program a chance. Now, they put me on, so they started dosing me at 10 milligrams. And then that worked for me. And then they bumped it up to 20 milligrams. And so I was on methadone of 20 milligrams for the duration of my time in jail, so about a month. And then when I transferred out of jail, I went to an inpatient program at Swedish Ballard, also in Seattle, and I switched to Suboxone. It was just, I had tried Suboxone before, and I had been on Subutex, Suboxone, Vivitrol, and methadone now, but I knew that I wanted to be on something else, and Suboxone had worked for me in the past, so I decided to make that switch. So after that, I was on Suboxone, tapering 2 milligrams, 2 milligrams at a time, under the care of a doctor, right? Because I was still, I was going through the drug court program, King County Drug Diversion Court, and I was going through the drug court program. And so I was tapering off for about 9 months. And I can tell you that when I switched from 2 milligrams to 0 under the care of a doctor, again, I got that same feeling that when I was in jail, right? There was a little bit of withdrawal, there was a little bit of body aches, but again, it was bearable. If I could just very briefly, I just want to stop. I want to show you all something. Sorry, I got to do my background. Sorry, Maria.
No worries. I think I know what you're going to show
Yeah.
us.
So I have a couple of pictures to show you all. From 2013, this is my score mugshot. And then from 2017 or 2016. And the thing that stands out to me the most in these pictures, and I keep them by my desk because I work in recovery, and I think it's important for folks to, I think it's important for folks to see that this is where I was, and this is how I show up today. And the thing that stands out to me the most in these pictures is the blackness and the lack of life in my eyes. I'll never forget the time when my mom, in recovery, after I'd been in recovery for about a year, and she looked at me and we were just talking, and she said to me, she goes, "I can't remember the last time you made eye contact like this." There was so little, I was a shell of a person, right? I wasn't myself, and there was no life in me. And I think that these pictures reflect that. And it speaks to the emptiness that I felt every time I got locked up, right? Every time I went to jail. And my brother one time tried to take me to treatment because I had given my spiel, right, to my family. No, I'm going to do it this time. It's for real this time. It wasn't, right? But my brother didn't know that, and so he took it upon himself to drop me off at treatment. I didn't end up staying, right? I didn't even make it into the treatment. We sat in the waiting room for about 15 minutes, and in that short 15 minutes, That's all it took for me to change my mind. And I remember telling this to my brother. I'm like, hey, I'm going to leave. And in my mind, it's all planned out, right? Because I know that my dealer lives right down the street. I know that I can walk there. Everything's all planned out. And I tell my brother that I think I'm going to leave. And he ends up like chasing me into the parking lot and bear hugging me and he's begging me. And this is my only brother, my only sibling. And he's begging me not to leave. He's like, I'm going to call mom because he didn't know what to do. And I said, okay, call her. He gets on the phone with her. And my mom says, Antoine, just let her go. Right. They had to love me from afar. And so for my mom, when she told me, hey, you're making eye contact again, she sees this growth in me, right? And she sees this life coming back to her daughter. My addiction lasted for about 8 years, and it took a mental and it had a real lasting effect on my family. Friends, they were fair weather, they came and went, but my family was there with me every single time. And my mom was who I called when I went to jail every single time, right? And so she got tired of it, obviously. And so when I called her to tell her that I was in jail and pregnant, her first reaction was, you can't have this baby. A few years before that, I'd brought home a puppy Christmas Eve with absolutely no plan, no bed, no food. But I was telling my mom, no, this is a puppy. This will help me get sober. This will teach me responsibility, right? And so fast forward to when I'm telling her that I'm pregnant, she ended up taking my dog, by the way, because one time she came to this drug house where I was staying, took one look around, and how could she not take my dog? I mean, I was neglecting him. I wasn't taking care of him. It didn't teach me responsibility. And so I said the same things, though, when I told her that I was pregnant. And she had 8 years of broken promises, of broken trust, of broken experiences. She had 8 years of that to rely on when she said that to me, that you can't have this child. But this time, that is what I did. I got arrested May 6th of 2019. My recovery date is May 7th of 2019. My son just turned 4. He's happy. He's healthy. I'm present in his life. And I'm able to hold down a job. I've been with this position. I've been with this company, this organization that does amazing work, right? It's peer support. I get to use my addiction, which used to be so shameful, to instill hope in others. It's my story. I get to use my story of addiction and recovery to help others navigate their own journey, whatever it looks like for them. You know, I get to do that today. I get to help people. And it's a beautiful thing when you see folks that are making connections with one another. One thing I will never forget from every time that I've been in jail is that empty, lonely feeling. And then you get out and you say it's going to be different, and it's never different. It wasn't for me. It took so much for it to be different. It took me finding out that I was pregnant in jail for it to change. And that's different for everybody. It takes what it takes. And recovery is not a linear thing, and it looks different for everybody. And today I get to do this work that honors that. And Lieutenant Gepner is so progressive at SCORE Jail, right? That he is helping us do that. He's doing that in the jail. I'm telling you guys, not once before that 17th time I had to be pregnant to get put on medicated assisted treatment in jail. That's what it had to take. And for me to now have a team that goes into SCORE Jail and that's connecting folks, not pregnant folks, anybody that is suffering from from addiction and from trauma, and that's trying to heal from trauma, and they're in jail. And how are you supposed to do that when you're alone? And now my team goes into the jails and they're connecting with Lieutenant Gepner, and they're connecting with community organizations that are facilitating this and that are seeing folks as a person. When I was going through drug court, the judge humanized me for the first time, right? And I was going into court, and there was always this power differential between myself and the judge and the prosecutor. And that's something that was different this time in drug court, was that it's a whole multidisciplinary team coming together to see what's actually going to help this person, right? And so we get to be in the jails, and we get to go and make these connections with folks, and we get to use our lived experience to help them as they navigate their court journey, as they navigate their their legal issues. And it's very, very bizarre to me, because a few months ago, I got to do the most amazing thing. I was invited to go do a tour of SCORE Jail in a professional capacity. And when I was there, first of all, super weird being back. I walked down the halls with my hands behind my back just out of habit, right? But I saw two of the corrections officers that had treated me as a human when I was incarcerated years ago. And for me to be able to tell them, hey, I'm back and I'm doing good. I'm not back as an inmate. I'm back and I'm doing good. And that helps me to continue the work that I do when I see folks that we help come back and tell us that they're doing good, right? That's the light bulb moment. That's the moment that makes it all worth it for me. And so for me to be able to do that to these corrections officers and to tell them, hey, you played a big part in my recovery just by treating me like a human. It's a really fantastic thing. I was still surprised they let me out, thank goodness. So thanks, Jeff. But I really believe that we're doing revolutionary work by not treating addiction as a criminal problem, but by treating addiction as, recovery looks different for everybody. And locking somebody up because they have a substance problem is not the solution. And if they do have to be locked up, then have services in the jails. Have services in the jails, have medications in the jails, have something to not go crazy while you're in there, right? And I think that Lieutenant Gepner is doing an amazing job of that, absolutely amazing. And it's been such a pleasure to work with him in this capacity. And thank you all for being here and just listening to my story.
Thank you, Marjorie. I know you've touched our hearts and opened our minds, and we're just so grateful for your vulnerability and sharing your story. Thanks for all that you're doing today. I'm going to hand it over to Lieutenant Gepner.
All right, hopefully everyone can hear me.
Yes, your audio is
Perfect.
Excellent.
Just wanted to make sure. Had some computer issues this morning, so yeah, I guess just to start off with is, having this just be kind of a free-flowing conversation. If we get through all the slides, great. If we don't, oh well. But I think the biggest thing is just, understanding the experience of, from way back in 2012 to what it is now and to where we're trying to go. So can't thank enough for Marjorie and their team. I mean, they're part of our team now. They come on in, we have fun with them on a daily basis, so it's a lot of fun seeing these things. So SCORE, it is South Correctional Entity. It's a multi-jurisdictional regional jail. So we book people from Bellingham, Oak Harbor, Kirkland, Marysville, Shoreline, all along East Side. You kind of name it. We actually work with, I want to say 75 or 85% of King County cities now. So anybody who has an issue with or a struggle with mental health, substance use, or primary care problems, they typically send them here because we have staffing for it, to really bring these ideas and people to one place to help them out. Next slide. We have 24-hour medical care. A lot of jails do not have a lot of medical care. They just kind of the basics and call it good. We pride ourselves on really trying to address kind of some of the root causes of, how can we help them out? We're connected with the Opiate Treatment Network through several grants through the Healthcare Authority, which it's amazing. Some of you folks, I've seen familiar names. I've worked with you. Thank you very much. We try to accredit ourselves, try to bring the standard of what jails are and should be as much as possible. And our reentry system is ridiculous. Thanks to Marjorie, any type of peer, there's 100 different programs, whether it's a PAC team, something through a county, a court, individual providers, pastors. I mean, we work with what is really needed for that person, because one size does not fit all, and each person is kind of unique in what they truly need. So next slide. So we are not a private jail by any means. We are actually a government entity, and we are owned by 6 member cities, which, as you can see, are Auburn, Burien, Des Moines, Renton, SeaTac, and Tukwila. So those are our owner cities. The mayors and police chiefs run our administration, and then from there, they hire our executive director, Devin Shrum. Has a huge background in reentry in corrections with Department of Corrections. We're built 802 beds. We are connected with over 100 different organizations, entities, and people, which is highly needed because that's what's truly needed for somebody's recovery if they so choose. We are accredited by NCCHC, National Commission of Correctional Health Care, and Washington Association of Sheriffs and Police Chiefs, and we're PREA compliant. So we try to make sure our standards are top notch, and we're following the best practices, and even push other jails to bring their standards up even more. We're kind of known as the go-to jail for a lot of other places who struggle with some of the people. They don't have like a MOUD program at all. They just kind of say, send them here. So most jails, smaller jails, do not allow methadone. So if they're on methadone, they come here because we dose 7 days a week for all our MOUD medications. Next slide. So intake, somebody comes in, they do a basic health appraisal, mental health screening, substance use screening. We check for COVID, and then from there it gets triaged, depending. It's just like walking into a doctor. Here's some of the issues you might want to address. We have different specialists who can, whether it's a mental health professional, SUDP or SUDPT. And then from there, we try to start that process. We try to get as many people in our program as possible. We are always maxing out our capacity for what we have now. We can always grow, and that's what we're constantly trying to do. Our average bookings a day are 30 to 40 per day, and average length of stay is about 11.5 days. Next slide. So it's an average day. We do, med pass. We have 15 different housing units throughout the facility. Courts, we see 97 to 150 people with 25 different outside agencies. So, like today we're doing Island County Court down in programs. We're also doing Auburn. So it just varies depending on what's needed. But what's great is when I also have, Peer Kent in here, they can work directly if they're trying to get into patient treatment. It's a great care team right on site. If something's needed right away, the attorneys can talk to see what kind of arrangements and reentry plans are being worked on. We're facilitating 140 plus appointments, and you kind of name it, it depends on what a person needs. We try to do everything in-house to make it easily accessible. We have a handful of contracted folks coming in that'll provide SUD assessments, sick calls. If a court needs something, an assessment of some sort, we're going to give it to that person. It's not necessarily for the court. It's mostly driven by them. If they want something while they're here and they need it for, let's say, King County, which, King County Court, Well, we're going to get you that assessment. We're going to make sure you have that. So when you do leave here, you have something that you need and you want it. Trying to kind of help them remove as many barriers as we can. So we also have dental and any type of service somebody needs, medical, mental health, we'll try to take care of it. Next slide. So how I kind of got my start was working with Disability Rights Washington. They came in asking a whole bunch of questions concerning SCORE of like, how do you work with people with mental illness? Well, early on, we struggled with it a little bit. But from there, this is, I think, where it really helped me kind of understand from where I started, I started 2011. Pretty much my thing is I was taught all you have to do is make sure no one escapes, and when they get released, not your problem. Well, with working with Disability Rights Washington, they kind of really opened up my eyes and really gave me a different lens to really view. And I think that's where I started really understanding of listening to people. And when you listen to it from their lens, you really see it in a different light. And by working with them and figuring out what's best for the person that we have detained here. Well, they need these services. So how do we get these services? Well, I just start asking people, hey, can you come in and help these folks? Or can you do this? So we've really turned ourselves into more of, for lack of a better word, a conveyor belt. We will bring the people, you guys bring the services, because you're going to be working with them in the community anyway. So might as well meet them where they're at. And what I have found and sat there and watched is when somebody sees the same person coming back saying, hey, I'm here to chat with you. Do you need some help? Are you interested in help? Do you need anything? No. Time and time again, they come back fearlessly. And all of a sudden you see that person who never wanted help. Like, I think I can use some help. I think I'm ready to make that change. And by really changing our perspective on how we start to work with outside groups, it has exploded now. It's amazing. So if somebody needs something specific, we can usually find it in a short amount of time to find what a person truly needs of what might help them in their, path to recovery. Next slide. Overdose prevention. We have Narcan by the bundle. We educate them, try to explain things, and we don't hold people accountable. If you see somebody overdosing or somebody's holding or what, we will not hold you accountable. We just want to make sure that person is safe. So we educate everyone. We hand out materials. If you want Narcan, you can have it. As much as you want. We're even kind of thinking about potentially just putting it in the pods just in case, because unfortunately jails stuff does get through. We try to, get as many people on the program so they don't have to seek out those avenues of, the illicit drugs getting in, or if they ever do. So we've been doing a great job, because people have said, hey, somebody got released today and they offered me, illicit drugs. I didn't take them. And it's great seeing that growth of people struggling with this, but being able to have that decision making. Originally, I used to thought, somebody has an addiction, I was like, oh yeah, you just stop if you want to. Not understanding what true addiction is and really seeing it in a different light of going, this is what it looks like. This is how we were never trained for this. Now we train every 6 months. We talk about it. We explain it differently. So every officer we have understands it. We know it's just not like, I'm going to not do this anymore. And being able to relate to people going, hey, it doesn't matter if you've, come in, we've started you 6, 7, 8 times. I don't care. 20 times, fine. We're just going to keep on doing it until like, hey, well, this isn't working. Have you thought about Vivitrol? Let's see if that works. Nope, that doesn't work. Well, what about this? Giving them the options, the education for what's going to work for them as a person, I think is one of the very important things that, correctional institutions kind of struggle with, because we are very linear in some of our programs of like, this is what we do and how we do it. Well, you really leave it up to the person and their treatment program. Help guide them, educate them, and, really it helps them have a better understanding of, what works for a person. Next slide. So these are some of the places we kind of work with. As you can see, it's a lot of them. I'm kind of lucky to have SCORE in this place. I can, throw a rock and hit 5 or 6 different treatment areas. We're now taking it another step further, where now we're working directly with ABHS and some other treatment programs, to where we're trying to really push into the fact of, like, on Monday, I can call AVHS and go, hey, I have 12 people who we've screened, ready to go. They have no holds, no warrants. And AVHS can say, hey, I have 14 beds. We have 2 left over. So there you go. So we give people that instantaneous access to the services they need. Now, if they're not interested in, inpatient, they have IOP or outpatient, intensive outpatient, where the great thing is I have an officer who will drive you to your first appointment. So we're bridging all these little pieces. When they leave, they actually have a supply of medication, whether it's, Suboxone or Vivitrol. I mean, usually we give them the shot right before they leave. If it's just primary care, chronic care medications, we also do that. Clothing, it really doesn't matter. We don't have any one size fits all. It's you need a cell phone, I have a cell phone. Because how are you going to call Marjorie when you need help, or one of your other folks that you're working with, one of your care navigators? So it's all about collaboration, and the folks that are here on this call, I mean, you are the folks who actually make this happen. I say, the stuff I'm doing is not amazing. I just look at the room and go, I point at all the smart people and go, hey, you guys are smart. You guys talk about this because I know you have something that they need and they're doing something you need. So part of that care team is, it's great having that collaboration here of going, I have 2 separate entities that do similar things, but they're both helping the same person in different ways. And it tends to remove a lot of those little barriers and allows, easier, simplified, cleaner access, instead of just like, hey, get in line, let's do this. It's more of, you have that preferential treatment, you're getting exactly what you need, because you have a very vulnerable person, especially in the first 2 weeks when they leave. We need to make sure somebody's walking with them the entire time. So when you walk into the waiting room and you're sitting there for 15 minutes, that person's also sitting there with you, supporting you for whatever you need, saying, hey, I'm going to be here until you go in. And when you get out, I'm going to be there too. Because that's the support people need sometimes. They need someone to just kind of rely on and not judge them. Hey, if it didn't work this time, that's okay. I'm going to still be here. And I think that's what I've seen is really, really effective, of meeting the person where they're at, of going, life's a struggle for a lot of the folks we work with. And it's, when you sit down and listen to them, it can be pretty rough on some of them. So,
Jeff, we have a comment from your colleague, Kristen Rogers at Harbor Crest.
Okay.
Kristen, do you want to come off mute and share a little bit about your services?
Hi.
Hello.
So I don't know if many people know that we're over here in Grace Harbor County, inpatient medical detox and rehab. We do provide MOUD. We have 24-hour nursing and physician care. We have a pregnant women's program that's a 26-day program, and I believe we've worked with SCORE before on receiving pregnant women, but now we just instituted the ability to take Medicaid for everyone else who's not pregnant. So that's a new service that got expanded. So we take Molina and Amerigroup and open coupons for non-pregnant people. So we're able to help more who are suffering than we were before. So just want to put that out there in case, because I'm new to this position. I want to make sure everyone knows that we're here, and I'm available if you need to, if you want to come take a tour, or if you need resources, we can send them to you, and I can give you our intake gal's phone number, and she can help set you up for treatment. We're usually about a 24-hour, 48-hour turnaround.
That's wonderful. I
yeah.
will include your information in our recap, and
Perfect.
I will hand it back to Jeff.
Thank you.
Yep. So that right there is a perfect example of how we work, because typically when somebody comes in and, brand new, pregnant, opioid using, we typically rely solely on Swedish Ballard. So we have a good relationship with them, but now I have another one, which is great if Swedish Ballard doesn't do that. And the great thing is the folks and how far they're willing to go. It's having those connections of going, I can call somebody up and I know they'll be able to literally drive them all the way there without fail. They're like, done, I'll take care of it. We'll get you from point A to point B, get you into that program. And then from there, it's like, okay, here's our next steps afterwards. Even though you're not coming back to jail, I'm going to have you connect with this person who has supportive housing over here and these additional supports. So, getting back to where it was very once you leave our doors, not my problem. Well, we're right in the center of everything. We're essentially it's like a hub and spoke, where now it's like, even though I'm not going to be working with you, I'm going to allow, the care navigators of like, here's the people you're going to talk to afterwards to get you the things that you're going to need for this person's success. So it's like that of just like, hey, if you have a service, I'm going to utilize as much as I can. And especially knowing that it's like, oh, perfect, because I have Molina and Mary Group come in here. So now I get to say, hey guys, just so you know, when you find somebody like this, I can call them. They can make sure, the insurance is taken care of. I can make sure all the little pieces and parts. And it's just about navigating a ridiculously complex system, whether it's, the legal involvement, the aftercare, insurance, it's and having somebody who's not doing this for a living, it's like, good luck figuring it out. It's like, hey, your insurance, when you get out of jail, I don't know, most people don't realize this, your insurance is active but suspended, which means if you walk into a pharmacy, you need to pay cash unless somebody will take the time to call this number, to sit on hold, to finally get it activated. And it's like, so you get out of jail, let's say 3 o'clock in the afternoon, that's plenty of time. By the time you're said and done with getting just the basics of like medications, or, where am I going to sleep tonight, or where am I going to get my food tonight? These are the barriers that we try to remove by, here's a 30-day supply of actual medication when you leave. You need bus tickets. Here's a handful of bus tickets. If you need a ride to a shelter, we'll try to do that. So, but yeah, like that. Thank you very much for that information. And I definitely will be reaching out. It's having those programs is really nice to have, of an additional resource. So thanks. Next slide. So here's just kind of, this is part of our medical. We have a dedicated medical wing. So 80% of people walking in through our doors, they're on something typically. 60% is opiates. And as you can see, 98% fentanyl. It's pretty much in everything. Alcohol is about 20%, and benzodiazepines are about 12%. From there, they do the appropriate protocols, try to get them stabilized and support. We try not to detox people, but it's just, unfortunately, we're not quite there. So we want to grow and continue to grow to a point to where no one ever has to, detox. Those that are screened, if they're interested in our MOUD program, we try to get them in as soon as possible. We started 10 today, as a matter of fact. What's something I always like to kind of brag about, we've really become a model for other jails. I've probably worked with 75% of the counties and jails throughout the state of how our system kind of works. And it's really streamlining to a point to where it makes it a little more simplified for folks. We have kind of a dual system where we actually have an outside provider come in. We use Ideal Option. They help screen people. And then we also have our regular WellPath, our contracted medical provider, is kind of the lead provider. But if somebody is gone or we change contractors, I still have Ideal here, or we have capacity here. So it's a good system that a lot of jails are slowly starting to move to, because they realize that if something happens, let's say, all the providers go on vacation at the same time, which actually happened to us in November. We actually did more than we did the month before. So it's a great system to continue the care and the need that people have. So, and then when people get released, we have Narcan on the property, 30-day supply of medications. We provide rides, bus tickets, reentry bags, clothing, durable medical equipment, wheelchairs. I mean, you kind of name it. If somebody needs something and it's legitimate for their recovery, I'm going to do everything I possibly can do to make sure they have it. Does it cost money? Sometimes, but if it's a $50 phone, who cares? If they're calling to say, I need help, perfect. Some people are going, why didn't you show up to court? Well, everyone has Zoom and a phone, but you realize what I see is most people don't have phones. I'd say it's about 50%. So how are they going to get to their next appointment? How are they going to call to get that appointment? So, seeing some of these things that are very simplistic, it's, that's why we look at what they need from their lens. Next slide. So yeah, we're starting about 100 plus people per month. Vivitrol is about 3+, and we give them the option, whatever they so choose. People that are come in on buprenorphine, we actually continue them right away. Methadone, same thing. We do not start people on methadone, unfortunately. But if they are interested in doing that, we will definitely provide telecare to get, all the forms filled out, everything to go, and we can drop them off at that first appointment. One thing that people don't realize is how many, several thousand people we have actually started on a program or dropped off directly at the facility to give them that chance. I think that's one thing I can't say enough about one of my officers who bends over backwards, like, hey, how can we do this? How can we get more people? Do they need this, that, or the other thing? Just trying to think about what somebody needs and talking to them and asking them to go, how can we have these better successes? How can we do this? And it's great seeing that from when I started as an officer of going, that's not our problem, that's somebody else's, to now we're trying to be part of the solution of going, hey, we're able to do this. We're able to help people with their legal involvement of going, hey, they have a warrant here. Here's the contact information for the case manager or care navigator to call to quash the warrant. So that they can go into inpatient treatment. And just being able to coordinate and talk amongst one another is, we're all pulling on the same end of the rope finally. Next slide. So this is really just kind of a visual representation of, we look at it from the client's perspective. What do you need? Where do you live? What works for you? And then are you enrolled with somebody? Are you tiered with someone? Because if that's the case, then it's like, well, let's get them back involved. They know you better than anyone probably right now. So let's see if you're interested in changing. Then we look at going, do you have other things? Like, are you a veteran? Are you private pay insurance? We don't care. It's just like, well, I know there's services over here. Are you 18 to 24 firmly in the foster system? Well, I know there's services over here. So that's what we try to leverage, is really all the different programs. So whether it's a community court, I can help people leverage this piece, or if they're part of a PAC team, or if they're involved somewhere else. And then what do you need? I don't care. It really doesn't matter, but it's like, hey, I see you're kind of struggling with, substance use or mental health. It's like, mental health is a big one. Most people just kind of try to ignore it, of going, hey guys, a lot of folks around here have PTSD. They've had these bad experiences, and understanding it's okay to talk about it, and really trying to change, their thought process of going, it's okay to have these feelings. You should have these feelings, but let's address them. Let's talk about them. And, it's nice because we have MHPs. It's a private setting to where they can start kind of processing some of these things to really figure out what some of the root causes are of really getting into that treatment aspect. And then we also bring in other things like DSHS. We have able to apply for it, check balances, get a new card, insurance if they need to get signed up. We have the 5 managed care organizations coming in to make sure things are set up. Somebody needs to change insurance. There's all these little pieces and parts that we try to address. So when they do leave, they have this kind of idea of where they're going. Now, mind you, I think we still have a long ways to go. I still want to work on, just a larger collaboration with everyone, where we've done all this work. The peers and care navigators have done all this work, but where does that information live? And that's where I want to always try to find a repository of something where it's like, hey, here's my care plan. This is about me. This is what I have. These are my needs. I have these primary care, chronic care, substance use things I'm working on, but also part of that care plan is going to be, I really want to see my sister in Oregon. That's really important to me. I want to get my GED or go back to school. That's part of the care plan. It's theirs. It's their choice. It's not, hey, this is our singular program. This is all we do. And to qualify, you have to have a felony and XYZ. Unfortunately, that's how a lot of the programs work. But what we do is we try to augment those programs, fill in the gaps. You as an organization might only be able to do this many things, but I have a whole bunch more people who are coming in here on a daily basis. And just by working back here, it's like, they'll come in, I'll point, you need to talk to that person because they have transportation and rides. And they also have access to job or housing. So next slide. So these are just a handful of and with this, there's just a ridiculous amount of people we actually are working with. But these are some of our larger programs we're kind of involved with, of just kind of how far it goes. It goes, from the very grassroots of, here's your local healthcare provider, all the way up to Medicaid waiver, that's one I'm really excited about. So Medicaid waiver, so when somebody comes into jail, their Medicaid is suspended if they have it. So it's active but suspended. So the jail and the cities and whoever that is paying every single bill. So if they go to the hospital, the bill comes to us. If they want a transplant, we would pay for that. So some of the decisions on why they're here, depending on what the charge is, they don't necessarily want to do that. So now with Medicaid waiver funding, now that means it provides a resource for folks coming in, because now case management services are paid for. We now also have 30-day supply of medications that are going to be required to be paid for by Medicaid, and then also MOUD services. So now I get to look at it and go, I can expand my program. Now there's that support where we usually add capacity and we're instantly maxed out on capacity. And it's getting to the point where now I'm trying to max out the capacity, the physical capacity of going, we just don't have enough room, which is having so many people come into such a small space to be able to really push the envelope of what jail is, really change the paradigm of what jail is. It's, you know, sometimes they end up here, you know, talking with a handful of folks, sometimes with their recovery journey, they really said they needed to be here. They needed that chance to really limit the choices they get to make. And that's a big part of our success. I think we let people make their own decisions. We help guide them, give them every choice, but if they choose a different path, that's okay. We're not going to judge you for it. We're going to provide the same service again and again and again, trying to help you make some of those better decisions. Yeah, so I think there's going to be a big change in the next year or two with some services for other jails. And I think that's one thing to also remember. SCORE is definitely a unique jail, I found. Most jails struggle with this because there's bureaucracy or lack of staffing or physical footprint of how it's built. So some jails would love to do this. I've heard some of the chiefs talk about, we want to do X, Y, Z, but they can't for a number of reasons. There's other jails that just say, we're not going to do it. Not our problem. Well, hopefully they over time will change how they view things, because this is successful. Having people help people. I mean, that's the biggest thing. I think most jails really don't look at it like we do. You know, most people all ask, who do we have here? People say inmates, detainees, clients, family, friends, and neighbors. Because this person sitting right here, somebody's family, somebody's friend, somebody's neighbor. You know, and that's really trying to change, you know, that the culture of an institution, of a jail, and understanding. I think it takes time to really change a paradigm of what it is. So it's really, you know, keep on pushing. You have some setbacks, but you just keep on pushing, stand on your soapbox. Next slide. Care navigators. This is where Marjorie comes in. I mean, it's like all these little things that we don't have time, you know, to help with. It's the mental health appointments, chronic care, the legal involvement, understanding, you know, all these little nuances for each individual. Substance use treatment, housing, transportation, employment. And here's the biggest one. Fill in what you need. Each person's unique. Just because you think they need it, they might not. That might not be one of their things, but it's the guidance of like really reconnecting with my kids or something. It's like, great, let's make sure that's high priority, but let's first get you some stability or these other things. And it's understanding, you know, the social determinants of health. That's a big one. At first, it took me a long time to really wrap my head around that, but I think that's what I found is successful. So next slide. I briefly hit up the Medicaid waiver funding. So this, you know, we've been ready to go for about a year now, almost a year and a half now. And it's just a matter of everything to get put in place to be able to really start ramping up these programs that they're doing. We have Genoa Healthcare, that is a pharmacy. We have them on site. We've been doing medications for the last almost 2 years now, case management services here. We have the know-how and the blueprint. We just need some of the additional capacity building that is coming shortly. So next slide. So our chief, she's wonderful and amazing. I can't say enough about, you know, our executive director, our chief. That's really what makes it happen. They say, hey, let's go down this road and this path. Let's provide these services. So if you ever want to thank anyone, those are the two people, is Devin Trum and John. They are very, I just can't say enough about them because they allow this to happen. And then with everyone else here, especially Marjorie and her team, all the groups that are coming in here, that's what is the foundation of what we do now. Without them, we wouldn't be able to do a quarter of what we're doing now. So with that, I'll kind of leave it open for questions, comments, concerns. And oh, by the way, we do have socks now. Marjorie, we had this discussion a little while ago. Still don't have the pillows though. So it's there's rhymes and reasons for why some of the places do certain things, but some of the things where our boss found out, they're like, you guys don't have socks? Devin's like, order socks. So we now have socks. So
Thank you so much, Jeff. Questions or comments or things that you all would like to share out there?
and never hesitate to just ask those, I'm just curious questions. I love doing tours because it's a little bit of a smaller group of like, why do you do this, or why do you do that, or and just having that understanding and the experience, because people have different experiences, and really seeing it from different ways where, well, we do certain things this way because of the liability, or we do it this way because legally we can't force somebody to do XYZ or so.
Right. Sarah, I saw you came off mute.
Yeah, I just wanted to thank Marjorie for sharing her story and the incredible work that she does. I get to see her on a weekly basis, and I'm always impressed by just her in general. And Lieutenant Gepner, the work that you do in trying to humanize people that are suffering and struggling is so incredible. And I thank you because, we are all in this together trying to create change and help people heal. So thank you for everything that both of you do.
Thank you.
Yes. And Jeff is always available. He never says no. So if you want to connect with him, I know he would say yes. So we are going to go back to our slides. A couple of important things I want to share with you. We are putting a link. Let's do our preview first. You'll also notice a link in your chat that goes directly to an evaluation. We really rely on that feedback to make our sessions better. So if you could take just a couple minutes to click on that and evaluate the last hour, that will help us for the next two sessions. And I want to let you know that on January 10th, we are going to have our partners from Bicycle Health with us. We're very excited about this session to talk about how telehealth integrates into communities and builds bridges for people in recovery. And please join us for that. We will have a lived experience story, as well as looking at operationally how Bicycle Health has tried to reach into communities to build those bridges. Same time next month. Next slide. And as I said, we rely on you and your feedback. We would love to hear from you. When Zoom closes, you're also going to get the link, and we will do one reminder email just so that we can try to get a large cohort to get feedback to improve for the next few months and our next series that we will be developing. And the last slide is a big thank you for being with us, but more importantly, for all the work that you're doing in your communities, in your neighborhoods, friends, family, and community members. As Jeff said, if we haven't been there, we will be there. And we're just so thankful for Marjorie and Jeff and the way that you are walking the walk and helping all of us to be better and to do better and to learn. So thank you so much, and we will see you next month.